Thank you all for dialing in and welcome to this talk on why emotions matter. My name is Jenny Royal, CEO of Medipace, and I am so excited to welcome you here because this is part of our Science for All initiative because everyone can get involved in research. And if we share and work together from all different backgrounds, we improve the outcomes for everyone. This webinar today is co-hosted between Medipace, which is a values-first patient involvement and patient research company, and the patient involvement and collaboration community, PICC United, who you'll hear from in just a minute. It is our joint privilege and pleasure to welcome Dr. Molly Gracey here, who is also now working for Medipace as our research and operations executive. Now, Molly is going to talk about her PhD research, but this presentation is a little bit different from normal ones because she's integrating the personal experience elements with the impacts, the motivations, the perceptions, alongside the scientific research, which means we have a wide range of people attending, and every person might take away something different from the presentation. That's okay. All questions are very, very welcome, no matter where and what context they're from. Just please post them in the chat. And at the end, there is a Q&A session. Any we don't get through, Molly has kindly agreed that she will answer them afterwards, and then we will send them around along with the feedback form. So with that, I'll shut up and hand over to Lisbeth.
Yeah, hi, thank you. Hi, I am Lisbeth for PICC United, and we are our patient lead organization working to strengthen collaboration between patients, carers, researchers, and healthcare professionals. We focused on co-creation and making sure the patient and carers are not just heard, but are active co-leads in project and research. And we believe this is so meaningful change, and we are so glad that we could do it with Molly today as a patient and a lived experience researcher. So today's sessions, we are reflected on the same spirit on collaboration and shared learning. And Molly, over to you. We're looking forward to hearing your presentation.
Hi, welcome everyone, and thank you for joining us today. It's wonderful to see such a diverse group here. We have different patient groups, caregivers, industry representatives, researchers, and healthcare professionals. So whether you're here to deepen your knowledge, improve your practice, or gain insights for your own life, I hope this session gives you something valuable to take with you. So with that, let's get started. Today's webinar is about why emotions matter. The ability to understand emotions is a crucial skill needed to connect, empathize with others, and respond appropriately to our social environments. Yet, despite being at the center of our lives, emotions can be difficult to understand. Think back to a time where perhaps you or someone you know did not read the room correctly. Just this weekend, my partner James and I were discussing this time when 2-year-old James was sitting in church with his family. As it was coming up to Christmas, the minister lit an Advent candle during the service. Everyone in the church was feeling quiet and reflective until a very oblivious young James sings Happy Birthday at the top of his lungs because he thinks that if a candle is being lit, that must mean someone is about to blow out candles on their birthday cake. Although this is a light-hearted example, this showcases the importance of reading emotions and social situations. Today, we will discuss my personal journey and PhD research in a way that is scientifically grounded, clinically meaningful, and personally relatable. We'll talk about why I ended up pursuing research into people with Parkinson's and emotion recognition, what I learned from my PhD research, and going forward, how we could use some of this information. So on this slide, this is me as a newborn with my granny, someone who played a huge role in my early life. I included this photo because for me, research isn't just data and theory, it's personal. It's about understanding emotions and relationships in a way that honours the people who shaped us, supported us, and showed us what connection feels like. My granny was one of the first people to teach me the power of feeling seen and cared for. And that reminder of emotional connection right from the beginning of life sits at the core of why I do this work. So, during 2005, when I was 8 years old, I was told that my mum had Huntington's disease. At the time, I didn't understand what that meant, and there weren't really any resources out there to help explain this, especially not to a young child that age. It felt like an invisible weight sort of settled over my family, and it was quite an uncertain feeling. I didn't have the language for these kinds of feelings and emotions back then, but I was already starting to see how health conditions can change emotions within families and how changing emotions can also shape relationships and dynamics within the family structure. So that early experience planted a seed in my head. As I grew older, I became fascinated by the brain, first through understanding differences in cognition in people with schizophrenia during my master's in pharmacology at the University of Manchester, and then later through studying psychology and neuroscience. I even started a PhD working with fruit flies, which in hindsight was a terrible idea. They're not great conversationalists. There's not much human eye contact with a fruit fly compared to a human being. And I quickly realized that if I wanted to understand human emotion, I probably needed to work with actual humans. But that change in direction also influenced a change in the types of questions I was asking, from how do different medical conditions affect the brain, using tiny fruit flies and microscopes, to how do medical conditions affect people? How does it shape the way they connect, communicate, and feel understood? During 2008 to 2011, I was in my early teens. This was during one of the most difficult times in my life. I was diagnosed with anorexia nervosa and spent an extended time in hospital. But what I remember most wasn't the medical side, it's how often I felt unseen. Teachers didn't intervene when I was struggling with my emotions initially from being bullied, and nurses didn't ask what I was feeling. I wasn't just unwell, I felt completely misunderstood. And that experience taught me that feeling emotionally disconnected can make a person even more isolated than the medical condition itself. Fast forward though to 2020 when I started my PhD. I had a keen interest in understanding more about people with Parkinson's. And this is because Parkinson's and Huntington's are closely related neurodegenerative conditions where individuals can experience overlapping symptoms. And all of the people with Parkinson's that I had the pleasure to work with struck me as incredibly inspiring people with strong motivations to help advance research. The individuals suggested that they weren't just struggling with movement symptoms that are the first thing that a lot of people think of when they think of Parkinson's, but they also commented on feeling isolated from those around them. This reminded me of how I felt in hospital as a teenager, surrounded by people, but still deeply misunderstood. I was curious to understand if difficulties in recognizing and expressing emotions could be part of what's making it so difficult for people with Parkinson's and other patient groups to feel truly seen and heard by others. So this slide marks a recent meaningful milestone for me becoming Dr. Gracey. These photos are from my celebrations at the end of my PhD research, And this milestone represents years of learning, questioning, writing, and growing, as well as quite a few tears shed and many cups of coffee. But some of you scientifically curious-minded people may be wondering what research my background inspired and what I found through my research. So, during my PhD, I focused on how people with Parkinson's recognize emotions. In particular, I focused on emotion recognition through reading facial expressions. It is important to note, however, that this type of research isn't new. Understanding facial expressions has been explored in autistic individuals, in people with eating disorders, and in other neurodegenerative conditions such as Huntington's disease. However, my work adds a deeper understanding of how these abilities are impacted in people with Parkinson's and why these changes in emotions occur. But importantly, how did I actually test emotion recognition in people with and without Parkinson's and turn that into a measure of how accurately they identify different emotions? So, we used a task developed by one of my co-supervisors for my PhD, Dr. Sophie Sowden, and then utilised in autistic individuals by one of my former colleagues from my PhD lab, Dr. Connor Keating. Participants viewed videos of faces that moved and were represented by the outline of dots as seen in the image on the right. So participants then had to rate on the slider scale, which is this one, how happy, how angry, and how sad each facial expression in the video was. The videos varied in terms of emotion, because they could display either a happy, sad, or angry face, as well as the speed that they moved at, and how spread out or close together these white dots are. And this made the face appear either quite wide on the screen or quite narrow and bunched up. So, to really get a feel for this task, I thought it would be useful for you to try this yourself. I'm going to play a short video, and after you watch it, please type A, B, or C in the chat. So as you can see on the screen, A is for happy, B is for angry, or C is for sad. So if you take a moment to watch this video and then pop your answer, please, when you're ready. I'll play it again. Yeah, it is hard, Jenny. Actually, a lot of people think that, oh, emotion recognition, this must be quite easy, but when you actually see what it is, it's pretty difficult. We're getting lots of C's, couple of B's. Play it one more time. I think it's mostly C's and a couple of B's. So yes, the answer is actually B. It's angry, but it's anger slowed down. So yeah, I don't think anybody put A. I mean, that's quite obvious, but it is easy to get these mixed up. So this was just a pause to kind of reflect and show the task isn't maybe as straightforward as some people think. So clinically, this is important because reduced emotion recognition can affect everyday interactions, including conversations with loved ones, interpreting social situations, and feeling connected with other people. By understanding these changes, we can support people earlier. We can tailor communication approaches in personal and research in healthcare settings, and ultimately help to protect the social connection and emotional well-being in Parkinson's. So what did we find when we compared people with Parkinson's and people without Parkinson's when they completed this emotion recognition task? For those of you who may be less familiar with graphs, please don't be put off by this visual. This graph simply shows the average emotion recognition accuracy score calculated for happy, angry, and sad. The score simply indicates how well people recognise each emotion, with higher scores meaning better recognition of the emotion. So the higher the bar rises, like we can see here, that kind of represents the more accurate people are at identifying that particular emotion. The green bars represent people with Parkinson's, which is just abbreviated as PWP at the side, and the yellow bars represent the controls, which is people who do not have Parkinson's in the study. And it's clear to see from this graph that the yellow bars typically are higher than the green bars for happiness and sadness. And this means that people with Parkinson's are more accurate at recognizing happy, and people without Parkinson's are more accurate at recognizing happy and sad facial expressions compared to people with Parkinson's. However, for angry, you can see the bars kind of look like they're a similar height here. And this means that people with Parkinson's and people without Parkinson's have a pretty similar ability for recognizing these angry facial expressions. However, what does this look like in the real world? Well, in this image, we can see that a healthcare professional is smiling at a patient in the bed. The patient is shown to be a little bit confused about what emotion she is expressing and potentially a bit unsure of how to respond. In this section, we are now going to compare emotion recognition abilities for people with Parkinson's when they have taken their Parkinson's medication, which is referred to as being on their medication, to when people with Parkinson's have not taken their medication, which was referred to as being off their medication. So, similar to the last graph that we talked through, this graph again shows the average emotion recognition accuracy score calculated for each emotion, happy, angry, and sad. The higher the bar rises, the more accurate people were at identifying that emotion. And the yellow bars represent the results for happy, the red bars represent the results for angry, and the blue bars represent the results for sad. If you compare the 3 bars for when people with Parkinson's were on their medication, which are the bars on the left, to the bars that are on the right, which is when people with Parkinson's were off their medication, hopefully you can see that the bars for on their medication are taller. We also confirmed this using some statistics showing that when people with Parkinson's take their medication, they seem to be more accurate at recognizing all of the emotions that we tested, which again was happy, angry, and sad, compared to when they didn't take their medication. But again, let's think about what this might look like in the real world. Perhaps if a person with Parkinson's comes into a healthcare setting, such as a GP or hospital appointment, before they take their medication, and a nurse smiles at them, they may be confused and wonder, why are they showing their teeth? Are they making fun of me? And that might make the person feel quite uncomfortable and nervous. However, if that same person came to their appointment after taking their medication and the nurse was to smile at them, they might recognize the happy facial expression slightly better and may feel more relaxed and reassured. So now that we have established that people with Parkinson's have reduced accuracy for recognizing happy and sad emotions compared to people who do not have Parkinson's, and people with Parkinson's have a general reduced ability to recognize emotions when off their medication compared to when they are on their medication. However, could there be a reason for the differences in abilities that we've seen so far? During my PhD, I investigated a variety of different factors that could contribute to differences in emotion recognition abilities between people with Parkinson's and people without Parkinson's. One of these factors was the distance between the white dots in the facial expression recognition task that I showed you earlier. So that's just on the right here. Interestingly, if we look at this graph, it shows the average emotion recognition accuracy score again. However, this time the accuracy score is calculated for different distance levels between the dots displayed on the screen. So the label S1, this one here, represents when the dots are squashed up close together, and that makes the face appear less spaced apart on the screen. The S2 label represents the natural spacing level between the dots, or the original spacing level. So, in other words, the distance between the white dots didn't change. Finally, the S3 label, which is this one on the far right, represents when the distance between the white dots was increased, making the face appear more spaced apart and wider on the screen. Similarly to the previous graphs we looked at, the higher the bar rises, the more accurate people are at identifying that emotion. In this graph, the orange bar represents data for people without Parkinson's, whilst the green bar represents people with Parkinson's. We can see that for the natural distance for S2 between the dots and the wider distance level, the green bar seems to be a little bit lower than the orange bar. And this means that people with Parkinson's have reduced emotion recognition abilities compared to the other group. But this wasn't the case for when the distance level between the dots was smaller. So we can see in this one, there seems to be a bit less of a gap between these two bars, which indicates that people with Parkinson's and people without Parkinson's perform similarly when the dots are close together. When we think about communication support for people with Parkinson's, it's important to remember that understanding facial expressions can already be challenging for many people with Parkinson's to interpret. And that means our environment and our choices can either help or hinder connection with individuals. Whenever possible, avoiding wearing sunglasses or heavily tinted lenses in clinical and research settings could be advised because it obscures the eyes, which could obscure another source of emotional information from the face. Similarly, when protection is needed, perhaps if it could be, people could opt for like a transparent face shield rather than an opaque face mask. So clear barriers would help to preserve access to the whole face, which supports understanding, it reduces cognitive load, and promotes trust. It could be important to also consider lighting in the room as well, ensuring that there's ample light, especially on the face. It might help individuals to clearly see the whole face and enable them to potentially pick up on maybe cues that are more subtle, like micro expressions. As seen in our motion recognition task that we talked about earlier, distance may also be a contributing factor to determine how accurately people with Parkinson's can understand facial expressions. So if you can, perhaps it would be advisable to give some space. Perhaps more physical distance combined with good lighting could enable the individual to have a clearer perceptual field. In addition, it could be considered to incorporate emotion visual aids. A simple card or digital chart of facial expressions, or even paper with emotion words that are written across it, could be incredibly grounding for people because it allows the person to point to how they feel, and it gives you a tool to explicitly communicate your emotions in return. And this transparency and shared reference could be especially helpful in clinical trials where interpretation errors could influence data. It also could be useful in hospital settings where clarity impacts care, and for families at home who want to support emotional connection day to day. Ultimately, the bottom line is that potentially some small environmental and behavioural adjustments can dramatically improve communication, quality, dignity, and emotional safety for people with Parkinson's across research, clinical care, and everyday life. Before I round off by thanking the individuals who helped to support me during this webinar and the PhD, I would like to briefly reflect on what this experience has taught me. Patients are not problems to solve, but they're people to understand. We are all wired for connection, and emotion is the language that connects us with other people, even when our words fail. And when we lose this shared language, we lose each other. So if there's one message I hope that this research leaves you with, it's that healing isn't just about curing diseases. It's about helping people to feel seen, heard, and understood. And with that, I would like to thank the host of this webinar, MediPace, as well as our wonderful co-host, PICC United. And finally, this work would not have been possible without some very important individuals. So I'd like to thank my supervisor, Professor Jennifer Cook, as well as my co-supervisors, Sophie and Ned at the University of Birmingham. I would also like to thank all members of the Cook Lab, in particular Dr. Connor Keating, for all his help and moral support throughout my PhD. Thank you to Parkinson's UK and the Centre of Human Brain Health for helping me with recruitment for my studies, and to the MIBTP and BBSRC for providing me with funding for this study since 2020. And last but certainly not least, thank you to all my wonderful participants out there. You have inspired me, and you're the reason that this work was possible. And I truly cherished all of our chats and emails together throughout. And finally, thank you so much for joining me today. And I'd love to open the floor. So does anybody have any questions?
Brilliant. Thank you, Molly. Just while, please put any questions in the chat. I know we have some already because when people signed up, they put in questions. And I know, Lisbeth, you have a list of those. But Molly, just to say thank you. I think it's such important research for the interactions in clinic, yes, but also for how people represent faces and emotions for connection with digital technologies, feedback forms. It can be used in trials, it can be used in healthcare. I just think there's so much to learn when we recognise this side of communication. So thank you very much. Lisbeth, do you have the questions?
Yes, I have the questions. Yeah, there were some lovely questions that we got before this webinar. So Molly, I will start by asking them. And please, everyone else, if you have any questions, put your hand up or put it into the chat. Molly, there was a question that if I want to read more about this research, can you answer on that?
Yeah, so there is my thesis actually about to be released on the University of Birmingham. It's the eData repository website, which I'm going to send a post-webinar email to everybody, and I can include the link in case anybody wants to read the studies in more depth.
Oh, thank you. I think that would be wonderful. I will look forward to reading it full time. So that would be good. Then we had another question I actually think is quite good is if you always have been a people's persons and turn into people's emotions, what that impact your ability to read people's emotion as the diagnosis process or not?
Yeah, this is a pretty multi-layered, interesting question. I would say that it depends what you mean. There's so many interpretations to this because emotion recognition, as we explored, it was through facial expressions, but it could also mean the tone of somebody's voice to infer emotion, or body language generally could be looked at. Um, However, in terms of what a people person means, if you mean that that person is quite good at connecting with other people and they're quite socially connected, there was a small side project I did at the beginning of my PhD, uh, and it was in autistic individuals where we looked at social connectedness scale. And basically it was trying to find or quantify a number of how socially connected someone is. So if that is kind of the interpretation by what you mean for people person, we would have to do more research to find out, basically. It's hard to get a number for how socially connected someone is, but there are more and more research going on in this field, and we're trying to build more scales and questionnaires that could quantify this, that would then enable us to answer this question properly.
I hope so too. And I actually think it was a good question. So we need to research
Yeah,
more on that.
totally.
There was another question saying, I am curious about the moment where painful, why me, experience turns into strength and purpose. What support that transformation, and how can we nurture it in other phases of similar fears?
Yeah, that is a good question. Initially, my way of finding it, it was important for me to find something to hold on to when I was going through my recovery for anorexia. I needed something to give me a sense of purpose and focus. And at that time, getting through my education and getting to research like really important concepts like this was very important. I hoped that one day I could help people who feel unheard the way I did in hospital. So I suppose for me, it was being at a low point fueled me with the energy to try to help others. But I mean, I think it's very different for everybody and totally individual.
Yeah, thank you. And I think you're so right. There is a force there that just came out of the blue. So
Yeah.
so you wanted to help other people because you know it's difficult. So that's true advocacy in my world. And Nat, do you have a questions?
Yes. I was just going to say, if you had all the time and resources to do further research, where would you like to take this? Or where else would you like to take it if there was something different to do?
Yeah, that's a really good question. I would probably initially I would like to expand on the different conditions that we looked at. So we focused on people with Parkinson's. I think it would be good to do this in people with Huntington's as well, because a lot of the research that exists out there for facial recognition in Huntington's is based on photographs. And that's not day-to-day life, is it? You know, you don't when you're trying to understand a friend who's upset, you know, you don't look at a photo of them. You look at their body, you look at their voice, you look at the way they're moving their face. And obviously what we did was that point light display emotion recognition task, which at least had the ability of using a video, so you could see facial movement. But I think it would be important to do more videos and more realistic emotion recognition research rather than just basing what we know off photos. I think that would be a big step for the Huntington's field. I also think it would be good for the other conditions I mentioned earlier. Um, my colleague I mentioned, Dr. Connor Keating, he does a lot. He's done a lot of research into autistic individuals and emotion recognition. So you should go check out some of his work too. But yeah, it would be interesting to just expand this out a bit more and move away from the more simplistic measures of measuring emotion recognition.
Thanks, Molly.
Thank you, Molly. Now we have some question that actually think is quite important in this research, because they were asking how effective are the current training of resources that are able for HCPs and families and carers on the topic of emotions? And is this training mandated for HCPs? I think that's actually quite important for this research.
Yeah, that's a very important question. Honestly, at the moment, training around emotions for healthcare professionals and families is pretty limited. If we look at other fields, though, for example, work with autistic individuals, there are some great practical tools and training approaches that could be adapted and used here. Things like emotion charts, there's visual skills that can be used to help identify and label emotions more clearly, both in yourself and the other person can then tell that individual, this is how I feel, by pointing to a face on a chart labels the emotion. And these kind of structured conversations can really enhance understanding and empathy in everyday interactions. Although it must be said that some healthcare professionals might get bits of communication skills workshops and empathy training, but it isn't consistent and it's definitely not mandated across most settings. So we're seeing increasing awareness, but it still needs a lot of attention because even for the doctor-patient relationship, having that emotional understanding between each other can really help improve relationships and quality of care and quality of life for the patients.
Thank you. You're so right. I am going to a question that I actually think is not on the list, but we just have an idea that it could be a good answer. People are integrating digital interface into care and clinical trials more. How do you think that research can inform that way with people with living neurological genetives? I think I'm saying it right. Conditions, yeah, conditions can interact and integrate with these. I think it's quite a good question for the clinicians here.
Yeah, I think as we start using more digital tools in healthcare and research, we really do need to think about how people feel when they're interacting with them, and not just how they function. From my research, we know that people with neurodegenerative conditions can sometimes find it harder to recognize or express emotions. So, if a digital platform relies too heavily on this skill set, on reading facial cues or tone or complex interfaces, it might not feel very accessible to everybody. So, I think what this work shows is that we need to design these tools in quite a smart way that feels human, clear, and intuitive, but also emotionally supportive. So, if that could mean using simpler visuals or more straightforward prompts or ways of communicating, build connection and not actually just confusing people, I think it's more what we know about emotion and communication to make digital care feel more personal and inclusive for this one.
Thank you, Molly. And now I will take it over to Jenny because we have, oh, there is a hand. So maybe we should try that first.
Go on,
Yeah,
Jen.
thank you, Molly. Thanks so much and congratulations on this important piece of work. I haven't worked in Parkinson's now for a number of years, but I'm really, I guess it's an observation maybe more than a question, but just to clarify.
Oh,
Got me? It's okay. I've been doing some work in kind of pediatric conditions, pediatric diseases, and this aspect of how children communicate emotions came up a lot. And having a 5-year-old myself and trying to teach a 5-year-old about feelings and trying to read feelings with other people, I just think there is a rich abundance of different approaches in those fields that might be really interesting to explore as well, to build on this important piece of research as well, and bringing it back to those basics. So verbally and non-verbally, how children can explain how they're feeling when they have different things communicated to them about their disease, and also then the parent or caregiver perspective as well, and how they have different options to try and explain and read. It's really, really interesting, and a super important area of research. So thanks, because your work's so important.
Yes, it's actually a good comment you made. There is some work out there in children, and actually I read a paper where they compared neurodivergent children, um, and they made them wear these, it's called Google glasses, and they essentially helped these children who might be struggling more with understanding their parents' emotions, and how to express their own emotions. And they wore these glasses, and then when they put them on, there was like a kind of like a emoticon, like a smiley face in the corner. And when they looked, for example, at their mum, the glasses would tell them, it would be able to analyze the facial patterns and tell them your mum is happy, or your mum is sad. And then they over time got exposed to this and began to learn what happy looked like, what sad looked like. So this kind of feeds into this really interesting idea of how we can almost help to train individuals to recognize emotions when it is difficult for them, even as children. We can do it in friendly and fun ways. So it's not all about, it's not all about people with just neurodegenerative conditions. This affects all ages, spectrums of conditions. So it's such important research.
Thanks, Molly.
Actually, just thinking about what Jill was saying, even though I accidentally muted you, Jill, I'm sorry, it was my fault. It was me. I own up to it. What Jill was saying and what Nat was saying, there are several interventions already existing, just not used in this particular area, and this research should be advanced further. Is there any benefit, do you think, of connecting all of those known interventions with research like this to try and test which ones would work best? Because if you can identify things that work well, that could then go into a guideline for people to follow that could be tied with different stages of disease or different scenarios, or even a way of trying to work out whether people need to behave a little bit differently.
Well, this is the thing, like quantifying things is always the most difficult part, isn't it? Like coming up with a score or a rank or a questionnaire that can quantify it in some way. So I think it's a really interesting question that does need explored more in the future. I think, whilst I said earlier that the work isn't novel, people have been looking at emotion recognition for quite a few years now. It really sort of 40 years ago, it really kind of took off a bit, and it's been gaining traction. So I think researchers are almost not even, they haven't been at the stage to even quantify all these different ways of looking at how these things could be useful for patients. But I think that is the next logical step.
Thank you. Nat?
Is there any research, you might not have the answer, but into how these patients communicate their emotions to others? Because I was thinking about, like, if you think about like the emotion wheel, like anger can be so nuanced, and you might be angry for various different reasons and feeling anger in in very different ways. And if you help people communicate reasoning or the feeling behind the anger, it can help them to feel better. And I wonder whether there's any research on that side.
It's so interesting. It feels like I told you to ask this question, but I didn't.
I swear
I
she
swear.
didn't.
But actually, if you read my thesis, which I think everybody should, the other chapter explains another potential mechanism that we looked into, which is, do people with Parkinson's struggle to understand other people's facial expressions and emotions because their internal world is a little bit mixed up? And what I mean by that is, are their own emotions internally a bit overlapping? And so we looked at happy, angry, and sad again. Used this wonderful task that was, well, my colleague, Dr. Connor Keating, used this task and developed it for autistic individuals. And then we did it in people with Parkinson's, and it was showing them different photographs of not facial expressions, but of validated images that might induce the feeling happiness, sadness, or anger. So, for example, an image that might induce happiness in a person is children running about and playing and jumping into swimming pools, whereas a sad image was maybe of, an animal being treated for a sickness at the vets. So they looked at these images and then they ranked how similar these emotions were. The images were in terms of emotion. But we find that they behaved overall quite similarly to people without Parkinson's. The general trend seems to be that sadness and anger can be quite overlapping. People, they're closer together because they're negative feelings, emotions, whereas happiness can be quite different. But yeah, it is interesting, these ideas that your own internal emotions could impact how you understand emotions externally. But I think more research needs to go into this, because it was, it's quite a novel idea, and future studies should recruit more people with Parkinson's, because one thing that I didn't get to test because I ran out of time was, how do people with Parkinson's compare when they are on and off their medication? Is there a difference in how their emotions feel on the inside when they take their medication compared to when they do not? So again, there's so much that can still be done.
Brilliant. Thank you, Molly. And we have a comment from Wen Ching in the chat saying that he's looking forward to exploring it with all his AI wizardry, which is always lovely to look at afterwards. So I'm sure he'll be back in touch. And with that, if there aren't any other questions, then thank you, Molly. That was lovely. It was brilliant and very well explained. So thank you very much. Thank you to Lisbeth for co-hosting it. And thank you to everybody for attending. The recording feedback survey will be coming around afterwards. Molly, you're going to send that around. So if you have any other questions or any thoughts, just reach out. But otherwise, thanks again and enjoy the rest of your day.